views and opinions expressed on the Healthcare Advocate Show do not necessarily represent the views and opinions of Connoisseur Media or its advertisers.
Revolution Healthcare Radio is brought to you by Home Helpers of Connecticut, in-home senior care services, and Protein Sciences, the creators of Flu Block, a safer, more effective flu shot.
It's Revolution Healthcare, the show that keeps you in the know about the ever-changing healthcare system. We all need answers to our many questions about health, and the revolution in healthcare, presented by Patient Advocate for You, making sure that your healthcare is coordinated properly. And now, here is Sharon Gauthier, taking your calls and sharing information. 1-888-574-2723. 1-888-574-2723.
Good morning and welcome to the Revolution Healthcare Radio Show. Sharon is actually on vacation, so I will be taking over the show for this weekend. My name is Fred Gauthier. I'm the producer for the show, and I also am the executive vice president for Patient Advocate for You, and we are a nursing case management company. And we basically put this show together because we're noticing there's a lot of stories, there's a lot of things in healthcare that just aren't getting talked about. And, it's very important for people to understand, especially from a patient's perspective, what's going on. So what I want to talk about today is what I perceive as a lack of innovation in healthcare and how it's really putting people's lives at risk. Now, excuse me, my observations of the healthcare industry are somewhat different than a nurse or a doctor because I'm coming from more of a business and patient standpoint. So, when we take a look at what's happening, like in a hospital, I'm looking at it as if, I've been to a hospital before, so I can tell you what it's like to be a patient, and I have to deal on a day-to-day basis with other businesses, hospitals, doctors, nurses, and I see what I perceive as like inefficiencies and lack of innovation. So apparently, what we like to do is argue with patients a lot and instead of just listening to them. So a good example of that is we had a client that went into the hospital and they were claiming that his lung was removed. Now, this was in his electronic health record. And it seems to me that it's very easy to figure out if you have a lung removed or you don't have a lung removed. You just either ask the client or you put a stethoscope on and listen to his lungs. Now, this turned into an ordeal for 2 days, an argument, and they wouldn't give him medication. And, this is all because of what I would look at as a bad process or, a bad quality measure. So now, when I say lack of innovation in healthcare, obviously there's quite a few innovative healthcare apps. I mean, there's some great breakthroughs in biotech. There's some good coordination programs out there. And it seems like, there's something new coming about every day. But where no one seems to focus is the actual improvement of processes. And, a process in healthcare is basically care coordination, and an improved process will result in quality improvement. So, care coordination is basically just a process that organizes a patient between multiple entities to, either get them out of the hospital or get them to the doctor or get them aftercare. And there seems to be really no innovation in that, and if there is, it's not at all efficient. So, excuse me. A good example of that would be the 30-day readmission policy. So just to give you a background on that, under Obamacare, one of the stipulations was that hospitals had to improve their 30-day readmissions. And what that means is when someone leaves the hospital, are they coming back because of a lack of care? Or are they coming back because the coordination isn't right? So, every year it goes up and there's more things added to the list, congenital heart failure. But basically, the reason for a 30-day readmission is a poor system. So when you're transitioning out of the hospital, one of the major things that ends up happening is you don't get your medication list right. So if you go back to your house or back to your long-term care facility and your medication list is wrong, and now you're taking the wrong medications, and that can result in you coming back to the hospital, and right there is because of a poor process. Another big issue is the aftercare. Now, especially if you're an elderly person and you're being sent out of the hospital and with a list of instructions, call this doctor, go here, go there. Maybe you don't even get a list. It's very overwhelming for people. What's not really taken into consideration from what I've observed is anything about that person's life. Are you elderly? Do you drive? Do you have an elderly person at home? Do you have family to help you out? What's your socioeconomic status? None of that's taken into account, and all of these things are they can have a huge effect on if you're going to come back to the hospital, if you're getting your care or not. So, they came out with several programs to help these readmission policies lower, to keep people out of the hospital. And one of the programs is the RED program. Now, the RED program, from what I can see, is basically a 12-point checklist that took 5 years to make and several $1 million. And, one of the things on the checklist is actually go speak to the patient and find out what language they speak. So in my opinion, it doesn't take several years and several $1 million to figure out to speak to your patient. It's situations like this that and bad processes that are riddled throughout healthcare. And I see every day, and I'm sure everyone else out there sees, there's a new healthcare app, there's a new this coordination, there's a new that, but no one's really sitting down and looking at how do we improve the process in the hospital. How do we improve the actual steps that are taken to either help people out, either get patients medications they need, or get them out of the hospital. Now, a good example would be of what I'm talking about, maybe to give you some frame of references. Everyone's heard of the $400 aspirin in the hospital, which is obviously a bit of an exaggeration. In reality, an aspirin costs, $10 to $20, which still is very expensive, but it's not $400. So if you take that same scenario and you figure out, okay, how do you get that aspirin? Now you ask a nurse, and then the nurse will email the doctor, and then the doctor will create a 10-point checklist of specialized medical professions, and then the nurse could come back with the list and make sure you're qualified to take the aspirin. And then after you take the aspirin, the results will be submitted to a doctor. Now, obviously, that is a terribly gross exaggeration of what actually happens, but this is how convoluted some of these processes become. Now, from what I can see, and a lot that we deal with directly for the patient, for the 30-day readmission policies, if you just had one person that was in charge of that person to go through the hospital, and they knew what your medications were, they knew what your history was, they know how to help you out to get coordination after leaving the hospital. That seems like a much better fix than a long group of checklist things, and that's just supposed to be applied to basically any hospital situation without knowing how much or what type of hospital it is. What are your procedures? Who's the person that's the head person? Is it the social worker that's in charge? Is it the doctor that's in charge? Every hospital is different. So it seemed to me that just a quick fix of that would be to have a person follow you through the hospital. Now, some of the major issues that end up happening from a 30-day discharge are, the transition. So if you could standardize that transition from a hospital to a facility, like a skilled nursing facility to home, and not have it be a different thing every time, this would help out. Patients are sometimes sent home with a prescription that they are often unable to fill. So this could be very dangerous. So you leave on a Friday and you have heart problems, and you're supposed to have medication that you need tomorrow. Now the pharmacy isn't open. Now it's Monday or Tuesday till you get this medication. Now, what is this person supposed to do? And this is something that happens on a day-to-day basis. So if anyone would like to call in, our number is actually 1-888-574-2723. I'm trying to speak a little bit about healthcare innovation. Later on, we have a gentleman named Christopher Fay coming on the show to talk about his new company, Big Bang Health. He's actually out of Texas. He's got a long list of healthcare entrepreneurial activities. Excuse me. So just to further speaking about healthcare innovation. Now, again, I'm not coming from a medical standpoint. I'm just coming from more of an operational standpoint. And you know, one of the major reasons why we started this show in the first place is because there's these issues out there that no one seems to be talking about. No one seems to be talking about an issue like, just take, for instance, the growing elderly population, and people are living longer. So every year, people are their life expectancy grows. So this is something that is going to continue to happen with the innovations in healthcare, and no one's addressing it. And a good example of that would be the assisted living facilities and the independent living facilities. Basically, they're on the same actuary table as they were 10 years ago. So now someone at the age of 70 does not have the same needs as they're going to have at 85. And these needs are going unmet, and it's causing problems for the patients, it's causing problems for the family, it's causing problems for everyone. And, no one seems to address it, because all that a lot of these companies end up caring about at the end of the day is keeping the beds filled. So that's something that is going to have to be addressed, because the over 65 population is growing and growing and growing. And, there's a good chance by the year 2020 that there's going to be people living to the age of 120 years old. And, what do we do at that point? What kind of care are these people going to need? How do you adjust to keep keep their health care going so that they can live a long and happy life? So I think we're about to go to break, and we'll be right back with Revolution Healthcare Radio.
Uh-oh, flu season again. Time to get a flu shot. You now have a choice in flu vaccines. You can ask for Flu Block.
It is the healthy individuals that carry and spread the flu. Every year, about 30,000 Americans will die as a result of the complications of influenza.
It's one of the reasons why I had an interest in it, is that our population, that our service tends to manage our elderly. People were having to get a booster with the flu vaccine. What I liked about Flu Block is that the people last year in our group, the clients of ours that got the flu vaccine, did not get a booster, and they did not get the flu. And the people that didn't get the flu block vaccine either got the flu in addition to getting the vaccine, or were told by their physicians that now we had to try to create a process for them to get a second vaccine.
The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
Home Helpers is a franchise in Connecticut, and what I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Welcome back to the Revolution Healthcare Radio Show. Today we're talking a little bit about innovation in healthcare, where it's lacking, what maybe we can do to further along helping out the patient, because, the whole point of healthcare is supposed to be to help the patient out, and so much of the things that go on in healthcare really don't evolve around the patient's needs, which, it's starting to make a slow change, but for an industry that's based completely on you getting sick or your health being monitored, and the healthcare industry is supposed to help you out with that, it seems that it would be more patient-centered. So we got Chris coming on the show probably in the next couple minutes, but I'm going to talk a little bit about a story we have that will maybe highlight the issues with the lack of good systems in the healthcare industry. Now, we had two pharmacists who 30 years in the industry, seasoned healthcare professionals, and one of them went in for some sort of procedure where he had to get some surgery on his back. So both of them went into it thinking, they knew how healthcare worked, they wouldn't really have to have any help. And once they got involved in it, realized that it was very confusing, even for people who are involved in healthcare. It's very convoluted. There's no really continuum of care. So what ended up happening is a pharmacist actually was given the wrong dosage of his blood pressure after being transitioned out of the hospital and into his recovery place, and they almost sent him back to the hospital because it jacked his heart rate up, and he was shocked at this. Being a pharmacist, you wouldn't think that you would get the wrong dosage of medication, but it goes to show that no matter who you are and what area of healthcare you're coming from, this can happen to anyone because a process that's not correct, bad communication, this all adds up to putting a patient in danger. So, excuse me. Another aspect of healthcare that we were promised was supposed to be this huge game changer, and everything was going to be across the board. Communication will be better. Outcomes will be better. Are the electronic health records? So now the electronic health records, I don't think anyone can argue, are great. They'd be fantastic if they work correctly. But now 5 years later or 6 years later, what we have is several different electronic health records. It's very hard for them to communicate. A lot of times there's incorrect information in there. And there's a lot of surveys and research coming out that it's not really helping out with anyone trying to use it. Now, I'm sure there are good outcomes for the electronic health record, and I'm not trying to say that that's not something we need, but it just basically points to the fact that there's not enough attention put to the process of how these things are used. Because when I say process, what I mean is not managing the nurses or managing the doctors per se. It's managing the systems that they have to abide by in order to get something done. So if you can have the greatest nurses and the greatest doctors and they're all working together, if their means of communication in their system that they go by is not correct or it's faulty, it's gonna result in bad outcomes for everyone. Another area that healthcare seems to need a lot of help in or really start paying attention to would be outcomes. Do we have our Chris? Okay, I think Chris is calling in right now. All right. So outcomes for healthcare is something that hasn't really been paid attention to for the most part. And this is really unique to the healthcare industry because any other industry, your outcome is very important. So if you went to get your car fixed and you paid $30,000 or $20,000 and you left and your transmission fell out, you would go right back and you would expect that they would fix it, or you would expect that in the first place it was done right. In healthcare, outcomes are not really taken into account. So when you're just getting a procedure done and something's whether it just be medical or you're going to a healthcare professional for them to give you some medication or okay. Looks like we got Susan from Florida on line one. Are they on? Hello, Susan? Oh, I guess she's not on right now. Basically the outcomes in healthcare, if they're not, if no one's paying attention to it, which they're not, it seems that that's not very patient-centered at all. Now, one of the things that Obamacare has been trying to at least pay attention to or bring to the light that I don't think a lot of people are talking about is they're making hospitals, making doctors, everyone responsible for the outcome. And that's what part of that 30-day readmission status is. So basically, if your outcome is poor, then you're being penalized. So it's forcing people to... Is Susan online now? Hello, Susan? No? All right. Apparently we're having some phone issues here. So the outcomes are very important in healthcare, and it's just now something that's starting to be paid attention to, which is basically where we're going from a value, from a pay basis to a value based system is what the Obamacare system is trying to switch us over to. And you would think it'd be very important to a doctor or a nurse or a hospital to know what your outcomes are, and they want to make sure that you get better. and they want to make sure that the treatment that they're giving you is correct, but, it hasn't been like that for so many years. And, trying to make that change is obviously going to be very difficult, but I think it's imperative to get healthcare to where we need it to be, because, quite frankly, from what I've seen from being involved in healthcare, and that's not even from the medical side, is it's very scary out there, especially to get old in this country, or to experience having to go to a long-term care facility, or having dementia in this country is absolutely terrifying. And it's a problem that's doing nothing but getting worse, and people don't seem to be dealing with it. I mean, the level of misunderstanding and training and lack of training surrounding someone with dementia is it's really terrifying. So, we've had clients that have gone to the hospital and they've been, put in a room or strapped down because people don't really know, oh, well, this person has dementia, and they don't really know what's going on. So you would think that the healthcare system, or that the hospitals and the doctors would be a little better trained to deal with this. So a good article that came out about a year ago that kind of highlights the lack of innovation and really shows why this is a problem in healthcare. It came out of the Mercatus Center, which is from George Mason University. It was written by Mr. Robert Grebels. So basically, it's called The Fortress and the Frontier of American Healthcare. So the fortress and the frontier refer to two different types of environments that business can be under. So now the fortress is an institutional environment that avoids risk and protects established producers, insiders. So that is basically where healthcare is right now. Healthcare is very risk avoidant, and that's why a lot of times we see a lot of these processes and a lot of innovation is not really it's not really apparent in healthcare, because a lot of the outsiders are not allowed in, and in order to have true innovation, you need to take a little bit of risk. And when I say risk, I don't mean risk as far as putting patients at risk, but unless you have an environment that allows for anyone to come in and actually be able to make a change, then it's really difficult to have some sort of disruptive innovation. Now there's a word that's been thrown around a lot as far as healthcare, and we see disruptive innovation would be an example of that is what Uber did to the taxi industry. Now Uber came along and disrupted an industry that no one thought the taxis were ever going to change, because that was just a great way of being picked up. And okay, we got do we have Linda on the phone? Hello, Linda?
Yes.
Linda, how are you? Thank you for calling in.
Hi. I had a question. I had a family member, it was actually my father-in-law, who was in the hospital a couple of years back, and he had a procedure, a urinary procedure. He came home with a catheter, and they had no plan for how that catheter was going to come out, except that a one-page sheet on how to do it yourself thing. And to me, that's like a nursing function. It's certainly not something that he was capable of doing. And I'm just wondering, I'm sure there's lots of scenarios that happen like that, because people don't seem to be in the hospital for very long these days after they've had a procedure. And I'm just wondering, how could you best arrange to prevent that, especially like if family that would normally oversee this person live long distance or something? How could that be prevented from happening so he's at home floundering without any proper assistance?
Yeah, I mean, that seems like a good example of a bad process. So, I'm not a medical person or not doctor or nurse, but from my perspective, the reason why he was sent home with just a piece of paper and, put in charge of his own medical procedure is because at some point there's a failure to recognize that that's a problem, and there's no procedure put in place that would allow that not to happen. So, if someone sat down and looked at it and said, well, wow, we can't send this guy home with a catheter, they would maybe put some sort of system in place that would hook them up with a home health care agent or hook them up with a nurse or someone's got to be there to oversee to make sure that stuff like that doesn't happen. I mean, I've heard stories of people being sent home with their elderly husband and a wife is put in charge who is not even trained at all medically, not a nurse or anything, is put in charge of doing his IV, which, to me is insane. Like, you're going to put someone in charge of an IV, like the chances of something going wrong are terrible. And again, that to me, from an outsider looking in, and I might be wrong, but that seems like just a terrible failure of process and procedure.
So how could that be prevented? Or if a family member or a neighbor or something of this kind of a person identifies that there's someone that's been sent home and is like that, what could they do? Who could they call to try to coordinate getting that person some help? I mean, that's something that our company could actually help out with, or you can call, any nursing case management company. You can call a VNA. You can even call your doctor and ask for help. Just call somebody to figure out, who's supposed to do this. Now, from our perspective, we would probably just coordinate a visiting nurse to come in and take care of something like that so that they don't have to worry about that. How would we get in touch with your company? You can give us a call during the week. It's 860-703-1575. And it's Patient Advocate? Patient Advocate for You. Yeah, you can check us out on the our web address is actually patientadvocateforyou.com. And there's plenty of information on there regarding care coordination and if there's any issues that come up with anything related to your health care. Okay, great. Thank you so much for the help. I appreciate it. Thank you for calling in. Okay, thank you for calling in, Linda. That was a good question, and this kind of stuff happens quite a bit, and I don't want to sound like I'm blaming any of the healthcare professionals, because really, from my perspective and how we try to approach healthcare is, it's not the individual's fault usually. Like, there's not nurses out there, doctors, healthcare professionals that are intentionally trying to put patients in bad positions, but really it's a byproduct of a faulty system. And once you're caught up in this system, it's very hard to speak up. It's very hard to make some sort of internal change, because you're worried about, what you have to do specifically. You're worried about your job. So a lot of this stuff goes, it goes unaddressed. And, this kind of goes back to the whole fortress and frontier, mentality. And, the fortress mentality, another byproduct of that is there's not a lot of communication. There's not a lot of criticism of what's going on internally. So, without failure, without criticism, without communication, there's going to be no reaction. There's going to be no better processes and better ways to do things that are thought of. We're about to go to commercial now. We'll be right back with Revolution Healthcare Radio.
Here's the latest Channel 3 early warning weather from the Talk of Connecticut. Partly sunny and windy today with highs in the upper 50s. Mostly cloudy overnight tonight with lows in the upper 30s. Saturday, partly sunny and windy with highs in the upper 40s. Mostly sunny and breezy for Sunday, highs in the mid-50s. Get the latest forecast online at talkofconnecticut.com.
Uh-oh, flu season again. Time to get a flu shot. You now have a choice in flu vaccines. You can ask for Flu Block.
It is the healthy individuals that carry and spread the flu. Every year, about 30,000 Americans will die as a result of the complications of influenza.
It's one of the reasons why I had an interest in it is that our population, that our service tends to manage our elderly. People were having to get a booster with the flu vaccine. What I liked about Flu Block is that the people last year in our group, the clients of ours that got the flu vaccine, did not get a booster, and they did not get the flu. And the people that didn't get the flu block vaccine either got the flu in addition to getting the vaccine, or were told by their physicians that now we had to try to create a process for them to get a second vaccine.
The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
Home Helpers is a franchise in Connecticut, and what I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Welcome back to Revolution Healthcare Radio. We're talking about innovation in healthcare today. Just some observations about what I see are issues, or maybe could do better with the systems. I'd like to mention we had a woman doc call last week, and she is doing well. She called in about her friend that had a terrible situation with the home healthcare aides that was stealing from her, and we'd just like to say thank you, and I hope everything's going well. So to get back more to the lack of innovation in healthcare, there was just an article that came out on the Affordable Health Care Act that basically is saying when it came out, we were all told that it will pay for itself. Healthcare, the whole Obamacare thing is gonna yield enough savings, and it's gonna help enough people that it'll pay for itself. Now, there's a new study that came out showing that really the numbers that were used were very much faulty, because going up until the year 2040, nothing was adjusted for inflation. So just on that basis, if everything stays the same the way they have, which it's clearly not going to, we're going to be in serious trouble. And, this goes back to one of the issues that I don't hear a lot of talk about, and it's coming up quickly, is the elderly population, or the population over the age of 65, is going to explode in the next 10 to 20 years. And as that population rises, there's also going to be more and more issues of dementia. The actual caretakers itself are going to lower. So we're going to have this issue of more people that need care and less caretakers. So how are we going to solve that problem? Well, who's going to take care of these people? Where are they going to live? What kind of care are they going to need? Because right now it's already, we mentioned on a couple shows ago when we had Nora from AARP in. There's over 500,000. There's a 500,000 customers. There's a 500,000 caregivers in Connecticut right now that are unpaid. So if anyone would like to call in, the number is 1-888-574-2723. We're talking about innovation in healthcare. If you'd like to add to the conversation or ask a question, that'd be great. Again, the number is 888-574-2723. So to get back to the innovation in healthcare, now I would want to talk a little bit more about why we got into this and our view of healthcare. Like I said before, the healthcare system itself, I think, is more of the problem than individuals. So there seems to be a lot of the situations we come across, people are very gun shy. They're, people are afraid of being sued. People are afraid of making the wrong decisions. Our approach to it is not to demonize anyone. We just want to solve problems, and we just want to help our clients, and we just want it to be client focused, which, healthcare obviously should be client focused, but unfortunately, it's kind of gone awry, and it's not as client focused as it should be. So, to speak about the EHRs a little more. So, disruptive innovation. EHR was supposed to be a kind of a disruptive innovation for healthcare, which would basically come in and be a game changer. So, in a perfect world, if an electronic health record was universal and it kept all your information in there and it was very accessible and it would, did predictive outcoming, that would be great. But it seems to be that this is not the case, and it's causing more issues in some situations than it's actually helping. So there was a report that just came out recently called about people have a gag order on their in their contract. So if you're a major hospital and you have to sign up, you have to get some sort of EHR because it's mandated by the federal government. Within that contract, there's actually a clause that does not allow you to talk about anything negative that's happening within the system, which, this is putting people's lives at risk. This is not really a stipulation you would have in there as far as just to keep yourself from, or keep your company from the competitors. This is, you're not allowed to talk about anything negative about the system. So there's been reports that nurses have to do workarounds for this. There's reports, we have a caller, Susan from Florida. Hello, Susan.
Hi, how are you?
Good.
So, as you're talking about EHRs, I just wanted to tell you that in my electronic record, I had a wrong diagnosis. And when it was picked up on with one of my doctors, I was told that it couldn't be changed. They would have to find out who put it in there. And when I asked, how I would do that, they had no idea how I would do that. So when you go in the doctor's office, what you're getting is the medical assistant who is putting in the information about you, and I guess it's probably just a click thing, and they clicked the wrong diagnosis for me, but I had no way of knowing who did that, and neither did the doctor. So it took me 6 months to find out what office had done that and finally get it changed. But what's scary about that is that if I showed up in the hospital with this very serious diagnosis they put in there and I wasn't able to tell them I didn't have that because I don't have any family members around me, they would have been treating me for something I absolutely didn't have. So it was supposed to be put in place, my doctor told me, as a safeguard for information, but it actually turned in to be a nightmare for me, and I wonder how that is for other people.
Yeah, I mean, there's several stories. We've had a few clients of our own that have had to deal with, the wrong information being put into an EHR, and then trying to get something removed from your electronic health record is very difficult because a lot of times there'll be a lock on it, and the person who put it in had to. It has to be the person to remove it. There's a lot of issues, and again, I hate to be negative about it because the idea of an electronic health record is fantastic, but the idea of a lot of stuff is fantastic, and then you put it into practice and it's not working correctly. This could be attributed to a faulty system and poorly managed information, basically, because I know that a lot of these systems, and there's probably 10 major electronic health records, they have a lot of trouble communicating with each other. There'll be doctors, and for example, the new ACOs, a lot of doctor practices all have different EHRs, and then it's several $1 million to figure out how they're going to communicate. And I'm like I said, I'm not a medical person, I'm not a doctor or a nurse, but I would imagine when you're in an emergency situation, that could be very hindering to the kind of care you're trying to give and actually, put people's lives at risk. So, it's pretty scary.
Well, and my doctor's office information, the hospital can't access, so it seems like a fruitless connection. So yeah. I'm from Connecticut originally, but I moved down to Florida to retire. I picked up on your show on the internet, so thank you for what you do. I appreciate being able to listen to real information.
Perfect. Thank you so much for calling in.
Okay.
Okay, that was Susan from Florida, and thank you, Susan, for calling in. Yeah, I'm sure there's a lot of issues that go on like this, and where do you turn when you have an issue like that? Who do you talk to? If it goes back to the person that we had that, if it's as bad as your EHR is saying that you have a missing lung, and you actually have to argue with someone because there's a saying you have a missing lung on your EHR and you don't have a missing lung. I mean, that's just insane to me that you would that would even come up. So I'm sure there's a lot of other issues that go on with the EHRs. Excuse me. So to get back to the lack of innovation in healthcare, and I wanted to talk a little bit more about the fortress and the frontier mentality of healthcare. So, neither one of the parties seems to really help out healthcare, in my opinion. The liberals or the conservatives, there's clearly a complete difference in opinions of how we should work our healthcare. The liberals tend to blame the doctor basically for any sort of patient problems, and the conservatives tend to blame the patient. So at the end of the day, both parties are not helping because they're contributing to this fortress mentality where, outsiders are not really welcomed to bring in new innovations. Like, it's just a good example of that is the FDA. The several millions and millions and millions of dollars it takes to get a drug passed takes years and years and years. And it kind of puts drug companies in this situation where they're trying to maximize profits on a drug because they don't know how long it's going to be able to be on the market. They don't know how long it's going to take to get the next drug on the market so that they can sustain some sort of revenue. So if you guys want to call in, the number for the show is 1-888-574-2723. Again, it's 1-888-574-2723. If you want to call in with a story or if you have a question or something to interject, we're about to go to another commercial in about a minute. And I don't know what happened to our caller. I don't think he's calling in from Dallas, but we can keep up with the stories here and answer any of your questions that you have. So I'd like to talk about another story that kind of blew my mind from it happened early on in my career in healthcare, that a woman she eventually ended up becoming a patient, but there's several levels of care at a long-term care facility, and one of the things for dementia would be a dementia ward. Basically, it's a locked unit, and that means you're in stage 3 dementia. You really need to be watched all the time, and you're probably not lucid at all. So we had a woman who was misdiagnosed, and she was put into a dementia ward, and she was there for 4 or 5 months, and no one noticed that this woman did not have dementia. She actually had a speech impediment from an injury she sustained years before that, and the total lack of communication and care kept a person without any dementia at all locked in a unit for 5 months. And I mean, it goes to show you how that's another poor process. Now, when we came in and we had a nurse go in and do an evaluation, it was very clear that this person didn't have dementia. But what happens to the person who doesn't have a caregiver to help out, who doesn't have a family member to help out, who doesn't have access to service like us? I mean, it probably goes on all the time. And this is, again, a lack of innovation in process, a lack of innovation in procedures. We're going to go to commercial, and we'll be back in a few minutes, and we'll answer some more questions, and we'll talk more about innovation.
For over a decade, Home Helpers has been making life easier for those in need.
I was very impressed when we first met. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. We actually had a good experience having a home health aide come in and give us respite to make it as comfortable as possible, keep them in control, keep them at home, which was very, very important to my family. Home Helpers share that same vision. We picked Home Helpers because they're extremely strict about the quality of care, the training of the caregivers. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
You now have a choice in flu vaccines. You can ask for Flublok. No actual flu virus is used to make Flublok. Flublok protects against the flu. No gluten, no latex, no eggs, no antibiotics, or no formaldehyde. Flublok is proven to provide broad protection against multiple strains of the flu. The next time you get a flu shot, ask for Flublok, the pure choice, because you have a choice in flu vaccines.
Welcome back to the Revolution Healthcare Radio Show. Today we're talking about innovation or lack thereof in healthcare. We actually have a caller, Danette from Windsor. Hello, Danette.
Hi.
How are you?
I'm doing well. I'm just listening to the show, and I just want to say thank you for getting this information out and having a discussion regarding the state of healthcare that we are, experiencing right now. But I just wanted to make a comment about systems. You talked about, the systems and how, poor communication, different things of that nature. I kind of like to look at everything as a glass is half full. I know that there is a lot of work that all our healthcare professionals are doing. And although when we look at the overall performance and outcomes, sometimes they're not as what we would want them to be. But I know that everybody's out there working hard. And I just want to make a comment about those systems. I think everybody wants to do what's right for individuals, but it is the breakdown in those systems that, gives us sometimes the poor outcomes that we're looking for. So I think as organizations start to, really focus on those outcomes and focus on making sure that they have, HIPAA-compliant care collaborative teams, team collaborations, that's really, really important because people automatically think that because, that there's numerous individuals that are caring for one particular individual, that they all communicate and talk. And that's not the case, especially, with HIPAA-compliant regulations. I'll give you an example. I've ran, assisted living and oversaw the operations of those. And a person in my assisted living can leave the community and go to a hospital. And you would think that just because, the ambulance picked them up at that particular community, that they would, call and collaborate and feel free to communicate. But that's really not how it can happen. So residents and patients, they need to advocate for themselves by making sure they voice, who they want to share information with, as well as, what type of information that needs to be shared so that they can talk freely about those situations and those, adult children that are advocating for their parents. If it's, in a senior living situation, they need to be on board as well as far as letting people know what information can be shared and you can share that information so that we all can talk together and really, focus on truly having patient-centered, resident-centered, focus for that particular individual.
Yeah, I agree. And it seems like, and I don't have any answers for it, and it seems like a very difficult system. Like, how do you put in place a system that keeps the privacy of everyone in mind and communicates with several different medical and non-medical institutions and people, and it's all in real time, and none of the information gets lost? I mean, that's quite a problem to tackle. But it just seems to me, and I might be wrong, that there's not a lot of emphasis on really going in and trying to break down it and fix the system. And the only evidence I can back that up with is just things like the 30-day readmission programs and just outcomes that we see and things that happen to patients all the time. It's just whatever's happening, it's not working. But you're saying that there's people are working at it now within the healthcare system to fix that because they're aware of the problems. That
Yeah, a lot of hospitals have, deployed committees and different things of that nature to be able to kind of reduce, put in initiatives to reduce the readmissions. They focus on different things and what their major problems are. They found that, there are certain, situations and issues and concerns that are key triggers. Medication management, can lead to an individual, having, being readmitted, poor transportation or lack of, transportation.
Yeah. Transportation is a huge issue, just across the board, There's actually, there's a hospital out west that's using a service similar to Uber called Lyft, and they partnered up with them, and they're giving people cheap rides, and they can watch right on their phone to the hospitals and back and to appointments. It's working pretty well. So I know, especially in Connecticut, and we see it a lot. There's just a huge issue with people having to find transportation to get to their appointments and to the hospital. So what do you got? What's your outlook on the aging population and how there seems to be a lot of institutions that aren't ready for people getting older and what their needs are going to be? Because we see that a lot with the assisted living and the independent living.
Well, I believe that I'm a glasses half full kind of individual, so I do believe that, just through discussions such as these and individuals that are in the healthcare profession that are, asking more of the organizations that they work for, once we begin to do that and we begin to, make committees, and, deploy initiatives on our own that focus on, making sure that we have the improvement that we're looking for. I do believe that it's going to get better because it has to. The demand for, that population of people and their needs is going to force us to come up with, better solutions and better outcomes. So I do think it's going to happen. I think that, we're at the position now where we are, basically trying to, develop, those initiatives. And, it's a tough situation because in the process, like right now, we do see, individuals that, are not having the best situation. But I think when those things happen, if there's someone, whether it's, an assisted living that those people live in, or if it's a family member that are caring for them, that they advocate for them and that they, try, as best they can.
Absolutely.
That they have, to, make sure that, the right thing is being done for them.
Yeah, kind of take your health care into your own hands. Okay, we actually have to go to a break, but thank you so much for calling in, Danette. Appreciate it. And we will be right back with the Revolution Healthcare Radio. Thank you.
You now have a choice in flu vaccines. You can ask for Flublok. No actual flu virus is used to make Flublok. Flublok protects against the flu. No gluten, no latex, no eggs, no antibiotics, or no formaldehyde. Flublok is proven to provide broad protection against multiple strains of the flu. The next time you get a flu shot, ask for Flublok, the pure choice. Because you have a choice in flu vaccines.
For over a decade, Home Helpers has been making life easier for those in need.
I was very impressed when we first met. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. We actually had a good experience having a home health aide come in and give us respite to make it as comfortable as possible, keep them in control, keep them at home, which was very, very important to my family. Home Helpers share that same vision. We picked Home Helpers because they're extremely strict about the quality of care, the training of the caregivers. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Welcome back to Revolution Healthcare Radio. I actually just spoke to the guest who was supposed to come on. There was an issue with the phone number, so we're actually going to have him on next week. His name is Chris Fay, and he has a new company called Big Bang Health, and they're basically combining a lot of different avenues he's been down with preventative care, with population health. So he'll get into that next week. we're going to be wrapping the show up here pretty soon. I'd like to thank everyone for listening, and if you'd like to find out more about the show, please go to revolutionhealthcareradio.com. We have information about our guests. We have information about the show. If you have any stories or you'd like to just talk to us about what's going on, there's a listener section, listener question section. And if you'd like to get more information about our company, it's patientadvocateforyou.com. And we actually have a podcast coming out starting in January. Now, the podcast is going to focus solely on individual stories of anyone from the healthcare system. Well, it could be a doctor, it could be a patient, it could be a janitor at the hospital, anyone who has a story, and most people do, of their experience in healthcare, how it affected them. It's going to be more of a long-form format, and it's a little more intimate than, say, the radio show, and we're just talking about personal stuff. So I'd like to thank everyone for tuning in today. Next week, Sharon will be back as our normal host, and I will go back to being the producer. I apologize for the technical issues for the guest who was supposed to come on. Again, he'll be on next week. He's got a really fantastic concept, so I would say go check out his website beforehand, and tune in next week so we can talk about how he's trying to really revolutionize himself, the insurance industry, to take a more patient-centered approach and to really deal with something that insurance typically hasn't dealt with in the past, and that is preventative health and helping you, avoid a crisis situation with a chronic disease, or your poor diet's putting you in a bad position. So their company's really trying to address some of that stuff. So yeah, that's about it. We're going to wrap it up, and thank you for tuning in. We will see you next week. Revolution Healthcare Radio. Thank you.
Coming soon, the Revolution Healthcare Podcast. The people who never talk and the stories that don't exist. The podcast is a more intimate, in-depth examination of the personal challenges caused by healthcare. The focus is on the human aspect of healthcare, from patients and families to doctors and nurses. They all have a story that needs to be heard. The Revolution Healthcare Podcast is available early January 2016. Thank you for listening to Revolution Healthcare Radio. Want to learn more about the show? Visit revolutionhealthcareradio.com. You can also access old shows, learn more about our guests, and contact us with your questions. Revolution Healthcare Radio, brought to you by Home Helpers of Connecticut and Protein Sciences, the creators of FluBlock.
Let Home Helpers of Connecticut make your life easy. Get a free consultation. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
No actual flu virus is used to make FluBlock. The next time you get a flu shot, ask for FluBlock, the pure choice, because you have a choice in flu vaccines.